Mask mandates across the country are lifted. You still need one on many forms of public transportation. Joining us, Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna vaccine trial. Great to see you, doctor. A little bit of a surprise today from the TSA. While everyone is ditching the masks, the requirements at least, the TSA actually extended theirs today through April 18th. That means buses, planes, trains, you still need a mask. Were you surprised? And I know you didn't make the decision, but why do you think they extended it?
Well, I was a little bit surprised just because the country in general has moved away from many of the mask mandates and many of these policies that have been in place for the last 2 years. That being said, 90% of our country right now is at a place of low viral load, really. And so the CDC mask mandates, mask guidelines wouldn't really even apply to over 90% of our country. That said, the TSA mandate today, extending their mandate, was a little bit of a surprise because our country really is in as good a place as it's been in 2 years. But apparently they want some more time so that they can figure out a more targeted approach as to when people should be wearing masks and, figuring out ways to not transport the virus across the country or to other countries.
Bottom line, if you're getting on a bus or a plane anytime soon, don't throw those masks away. Doctor, This is a word I would play every day in Wordle if it was 5 letters. Endemic. It's my favorite word right now. We're averaging less than 500 cases statewide a day. Hospitalizations dropping, deaths are down. So when do we officially hit endemic stage?
Well, that's a designation that the WHO has to put out there. However, it really has to do with the stability and the predictability of the virus. And the virus still, as new variants pop up here and again, isn't the most predictable of viruses out there. And so I would expect the WHO to continue with the headline of pandemic versus endemic, although it certainly feels much more endemic, like we have things, at least for the time being, under control, that the hospitalizations are down, the deaths are down, the cases are down, and we've done a very good job of getting us to a place where normalcy seems to be taking back to our regular lives.
Well, let's hope it stays this way. Dr. Bill Hartman from UW Health, always interesting things happening in the world of COVID-19, but we've had so much good news lately. We appreciate your time. Thank you.